Welcome to Times Media and the St. Cloud Times Editorial Board endorsement interviews for the 2008 elections. The Editorial Board is the voice behind the Times Review, which appears daily on the opinion page and website. Board members are conducting this and other interviews involving races and issues on your 2008 Election Day ballot. Board members are Times Media Publisher and President Bill Albrecht, Executive Editor John Bodette, Opinion Page Editor Randy Krebs, Community Representative Dory Larison, and Times Building Manager Mark Hessler. The board has neither say nor involvement in directing Times news coverage. Similarly, Times reporters are not involved in this endorsement process.
Again, it comes down to the state needs to live within its means. I think that by forcing the state to live within its means, you can force true solutions to the problems. Need is the mother of invention. I mean, healthcare solutions out there are not being addressed. There's Band-Aid fixes, it's increasing the size of the government, and it's feel-good legislation. It's not addressing the real solutions. There are real solutions out there. Education, I've talked to a number of people in the community. There are local business owners that would willing to step up and help support, not necessarily the school district. They have a need for mechanics, they have a need for welders, they have a need for painters, they have needs in the industrial industries. And I've talked to a number of industrial business owners that would support and I will tell you that their biggest fear was state involvement, but they would support buying the land, they would support putting together the curriculum, they would support for the kids that are in this sector and they're not necessarily working towards college but working towards a career. They support that. There are, there's so much with the state needing to be reconciled and overhauled and taken care of. It's not just the education, it's not just the redundancy in government, it's not just the political abuses for the per diems and the expenditures and the state. We are in a need situation. We need to overhaul and look at all of the processes, not just any specific one of the processes.
Okay. Larry.
I am going to address healthcare in my closing statement because that's one issue I think is extremely important. We've heard a lot about the Health and Human Services budget and the increase in the Health and Human Services budget. The increase oftentimes is referred to as an increase in welfare. I want to explain what the budget is. The Health and Human Services budget is the budget for long-term care and for individuals with disabilities. The stereotypical welfare portion of the budget is 0.6% of the Minnesota state's budget. The reason we're seeing the increases in our Health and Human Services budget is because people are getting older and people are having more complex medical conditions that are being able to be met by the medical industry. We need to address this issue with realistic solutions and not demonize it as a welfare expenditure. The people in nursing homes aren't a welfare case. What we need to do, though, in the welfare area, and I think we made some significant progress in healthcare, was we did the medical home model and payment reforms this year. We have to change the way that we pay for healthcare. We can do it better and more efficiently by focusing on prevention and maintenance of chronic healthcare conditions. Something I'm not proud of. I smoked for 13 years. I just quit on Thanksgiving Day. The visit that I had at the doctor's visit, I had to pay 100% of my doctor's visit. Because my health insurance didn't cover it. Although I probably saved thousands of dollars to the health care field. We need to do better, and we can do that, and we have started the groundwork on that. 93% of us are insured. We have to make sure that we focus on affordability for the 93% who do have health insurance. But we also should all have the goal, especially for our children, that health care is attainable. We have a goal, and we have a standard that every single car driver have car insurance. Shouldn't we have the same thing for our children to have health insurance? I'm a father of a 1-year-old. Without our health insurance, my 1-year-old would not be able to learn and be able to grow as well as he has in the last year. And it has been a wonderful thing to experience that. But we need to make sure that everybody has that ability.
Over here, and we are with
Dan.
Dan, okay. Dan.
I'd like to address a couple of the questions first on the leadership issue with the caucus. I think one of those, the reason I say no is because if you've ever been down in the legislature and you've been a majority or you've been in that process, you understand that it's like herding chickens. You've got people, everybody has an elected certificate, and you cannot compel them to do anything. So you come down there as a team, and to learn to work together as a team, sometimes you have to stay within the team work and try and put pressures on to get conformity so everybody understands that this is for the good of the whole caucus and not just for the good of the individual. I think there were some extremes that were put forward, and I don't necessarily think it was by the caucus. I think it was by some other outside sources that precipitated some of the hard feelings on that, and I wanted to clear that up. I think the issue on flat taxes versus the tax programs that we currently have is huge. I think that's something that we as a state need to dive into and start looking at in terms of what is fairness. If you've got somebody making 9.8 paying 9.8%, but they're paying $20,000 a year in taxes, you got somebody making $40,000 and they're paying $1,500 to $1,700 per year. That's a big disparity. But the issue is the guy's paying for the services that he's using. Is it fair to say that because they're not paying the same percentage that that's not a fair tax? I think a flat tax is a fair way to go. The education, we also talked about local, about the state funding education, and that's their responsibility. Part of that process is local control. How do you give the parents and the local community educators buy-in to that educational process if they don't have any skin in the game? Or if everything is dictated from the state in terms of what curriculum you're going to use and what mandates you have to actually implement. And part of that process is a feedback to say if we have some of that operating levy on the local taxpayers, then they have a say-so in whether or not you implement that or whether or not they're even happy with the educational system. And in the healthcare side, the whole process of moving towards a single-payer system is a place we don't want to go. And I think Representative Hosch would agree with that, but there are some fixes that need to be put in place there.
And Rob.
Well, I'd just like to clarify on the tax fairness issue. I certainly am not looking at this as class warfare. I'm looking at this as fairness. The warfare has happened to the people who are making the least amount of money over the past 6 or 8 years. They've been paying a disproportionate share. When it shifts to the property taxes, that's a regressive tax. And just the fact that you own property dictates that you pay tax and more tax based on owning property, not based on any ability to pay. And the people at the bottom are the ones who are hurting the most because of that shift that we've seen happen. And the governor's own Department of Revenue proved that in their tax incidence study. So that, that's not a partisan opinion, that's fact. When it comes to health care, there are a lot of things we can do. One of the things we need to do is we need to elect people who are going to be willing to stand up to the insurance, the health insurance industry. I've met with a lot of healthcare folks. I met with the leaders from Centricare, and they stated that about 20% of the cost of healthcare is administrative, because we got 6,000 health insurers or health insurance companies. They all have different forms and you have to have a myriad of people on staff just to do all that paperwork. There was a couple of bills last time that I'd just like to point out, because I want to point out the difference between Dan and myself on health insurance. There was a couple of insurance bills that came up last time. One was a good faith insurance bill. Minnesota is the only state that does not have this good faith insurance, where if the roof blows off your house and the insurance company doesn't want to pay you for that, you got to take them to court. You end up having the insurance under the old bill, you had to pay for your own attorney's fees. This was a bipartisan bill that passed. Dan voted against it. Massive flooding in southern Minnesota. Okay, thank you, I'm done.
Okay, how are we doing? Everything, we're good? Good. All right, that's it for now.